All right, so here's our video on what we kind of observed over the week in our training room as far as patient interaction and how they were helped when coming to the training room. Um, Looking at a couple of patients, it depends on honestly how often the patients come in. If it's a frequent user of the training room, a patient that comes in often, usually they kind of know what they're doing, so they kind of start their own stuff, and then the athletic trainer would come in later on and interact with them. But the mostly self-sufficient. That's kind of what I saw at my site, and on one end, and on the other end, if it were an athlete who's not used to coming to the training room, but they're aware of the resource, they'd come in and kind of sit around and on a table waiting for someone to talk to them. And depending on the busyness of the training room would depend on how long they're seen. And it depends on whether the trainer was working with another athlete or not. Usually, in Drake's situation, I would come in that situation. If the trainer for that specific team was working with someone else, I would approach them asking what they're here for, or if they need anything, or what's up, what do you basically need here, and kind of start that conversation with them, being the extra hands in the training room.
Yeah, going off of what Aubrey said, I kind of noticed too, it depends also on the relationship the athlete has with the athletic trainer. So, sometimes the kids that do come in a lot and know what they're doing, you can build that rapport with that athlete, so then you're able to go over there and talk to them, check in on them, and not really have to focus most of your attention on them. And then there's also the athletes that come in and overuse your services and are in there to avoid either being in PE, especially in our case. Some people have 8th period PE, and they'll complain about some sort of injury that's not true or anything, and we'll use that excuse to come in and skip class or miss practice. So you kind of get a sense of understanding what kids are trying to use the services to their advantage, and others that are actually genuinely needing to use the services of the athletic trainer. That's one thing I've noticed at Ankeny High School, is that you can just tell the groups of kids that are doing it as an excuse and the other kids that actually need it. And the relationships that the athletic trainer that I follow that build with the kids that genuinely need it is pretty awesome. And a lot of time is put into their rehabs and their treatments and stuff, whereas the kids that are coming in using it as an excuse, she will actually go and contact either the teacher or the coach and ask them about if they knew about it and if they heard about it or what had happened. And that a lot of the time will get the kid to quit screwing around and actually go back to what they're supposed to do.
Going off that, one of the questions was, were certain athletes treated differently and why? I think that's a big factor on if they are treated differently and why, because if you know that they are always coming in like faking an injury or trying to get out of the conditioning at practice or just not wanting to practice, you can have like a different attitude towards them, I guess, because you know that they're frequently trying to do that, and so it could come off that you are treating them differently, which I guess is not always a good thing, because you want to treat your athletes all the same and make sure they're getting the best patient-centered care. But if you are dealing with athletes that do come in all the time for a fake injury or they're just trying to get out of practice, maybe sit down with the coach and try and figure out, like Josh said, if they knew of the injury or if this is new to them, and then try and figure out a way of how to handle those different situations.
Going off of that, I wouldn't say there's favorites of athletes, but there's more favorite athletes to work with. Obviously, compliance has a big deal to do with this. So you don't usually want to work with an athlete who comes in for the same thing over and over again, given that you've given them at-home instructions on how to treat this, and they are not compliant, so they keep coming in with the same problem. For example, I had an athlete that was having back issues, and we asked if he was doing his stretches or his exercises at home, and he said, "No, I just this doesn't happen very often. It's just this one-time thing." Even though it's been, even in my time there, the at least second time he's come in for this issue, and then on the other hand, there's your athletes that actually are very compliant with whatever you give them for at home exercises and treatments, and they come in with issues, and you're more prone to work with them because you know that their issue can be solved and won't become a malingering thing that will just become reoccurring.
Mm-hmm. To go off on one of the other questions is, did your patients receive care quickly? I think that depends on the day, because when I observed at my clinical site, it was a game day for soccer. And so obviously the soccer athletes that were coming in at the same time as the track athletes were going to get care faster and get them taped and ready to go for their game. So I think it just depends on the day and the situations that you're in. You obviously don't want your other athletes to be late to practice, but just kind of prioritizing who you're going to go to first to get them where they need to be at that time.
Yeah, and not my current clinical site, but at a couple of clinical sites I've been at before, I've noticed that certain care or priorities are taken by the individual and, unfortunately, by their status on the team. So say there's a kid on the football team that he's only in for kickoff and kick return and doesn't really start on offense or defense. A kid who needs to get taped and is a starter on an offensive defensive side of the ball would probably take priority over a kid that gets in once or like 3 or 4 times in the game, which, I don't know, it does sound bad when you say it, but at the same time, you need to be the most efficient with the people that would be on the field the most or have the most risk at becoming injured and would use your services obviously better. I'm not saying the kid who was on the kickoff and kick return never got taped, but he had to wait until everyone else got their stuff figured out. It does sound really bad, but
I mean, prioritizing your obviously every athlete is equal and should be treated equal, but prioritizing what based on severity should be done. So, example I would say is if an athlete is having hamstring issues, and they play a lot, you want to see them before you would see someone who
needs their wrist taped.
Wrist taped, or at last minute wants to request a wrist tape even though they're not playing. Like I said, it's not an issue of one athlete's importance versus another. It's more so this hamstring athlete, if he goes back in on this hamstring because you don't see him quick enough and he gets called by a coach, it could lead to a more serious event of possible tear or even more damage done to the hamstring.
Mm-hmm. I think this is going to be an important factor, like, as future clinicians, if we are the only athletic trainer at our site, it's going to be really important to prioritize who needs to be seen first, but still making sure that the athletes are getting the care that they need and not showing favoritism over one athlete or the other, but just making sure that the athletes that need to get to where they're going, get to practice, get to the bus before their game, gets the care that they need, so future injuries don't happen.
I agree with that. Like Kelsey said, just making sure, if you're the only clinician too, that everyone gets the care needed. And like she said, it's tough, but you have to prioritize who needs it more, because who's at greater risk, someone that's playing or someone who's not playing. It kind of comes down to that. I don't know, this is kind of off topic, but have you guys seen anything about the athletic training room kind of being a social area? Because I don't know about you guys, but in my experience, the athletic training room is kind of where all the kids like to go hang out after school if they have nothing to do.
Yeah.
Stuff like that, because first of all, my clinical at my clinical site, my athletic trainer is actually trying to rebuild the athletic training room because there was a poor reputation around it with the clinician before her. So she's kind of trying to build the trust of the kids and having them come into her and feeling comfortable to bring their problems or issues that they have to her. So she's kind of being. She has the atmosphere very positive and friendly and welcoming, so that kind of brings these kids in who aren't necessarily in there for athletic training services, but are in there for the social aspect of the athletic training room. So I don't know if you guys have seen that at all, and if that's kind of like clogged up the efficiency of the athletic training room. Or
I've seen it in some days. My clinical athletic training room site or whatever is really small, so when that happens, she just asks the athletes to go to the hallway if they're not being seen and kind of wait in a line. I know for our concussion baseline tests, we can only have a few people in the room at a time, and then we just have to go through the line. But I think just setting the guidelines or rules, if you want to call them that, on how you are going to handle the athletic training room, just so the athletes that are in there get the proper care that they need when they're in there, and then just go from there.
I've seen that at many different locations. Honestly, I don't think it depends on the level. I've seen it somewhat at Simpson College when I was there. I've seen it at Lincoln High School. I've seen it at Ankeny. So, I mean, it not necessarily depends on the level. It just depends on how you condone your athletic training or what you allow. And granted, it's going to be worse in some cases more than others. Athletes usually, I'd say at Drake, are in there social aspect comes in combination with the treatment. It's not necessarily there's uninjured athletes in there, and if so, they're usually waiting on the person who's injured who is their ride, or vice versa. The person who is driving the injured person is the one that's in there. It's usually, most college students, I guess, are busy to the point where the treatment times are in the morning when between classes or between something they should be doing. So socializing in there is usually kept to somewhat of a minimum based on that being a factor.
Yeah. Another thing is some of the kids that aren't injured but still go there as a social aspect are kids that had long-term injuries from before. Like there's a few football players there that were coming back from an ACL injury and they're not necessarily doing rehab or treatments with us anymore, but just that social aspect that they built from being in there so much, it just feels like if they're not there that they're missing out on something or that something just isn't right. So I think being able to build that social aspect of the athletic training room but keeping it appropriate at the same time so that you're as efficient and being able to provide care to everyone and the cares that are needed to everyone's services is important as well.
Yep. And making sure that you're not just pushing away the athletes and making them feel like they're not wanted, but making that relationship known that if they do really need something that they can come and see you, but you're not just going to give them an excuse to sit out of practice so they don't have to do conditioning or whatever. Just setting the standards from the beginning so they know what to expect, and so it's not just like they're coming to you every time that they don't want to do practice or stuff like that.
I kind of, so that's my train of thought. So I'll keep going. I'll find it again. Going off another topic, how were athletes handled in the training room? At Drake, anyway, there's a kind of a set schedule for treatments. Anyway, for football, there's literally a wide window from 8 a.m. to noon. That's kind of where we saw as like the treatment area or the area where athletes are mostly seen. And if they come outside of that treatment area, they're usually not necessarily turned away, but they're kind of advised to come in and at a different time for future reference, just so that way this issue doesn't happen where we have an influx of randomization, influx of athletes at different times. It kind of like sets different windows so that way the athletic training room doesn't get bombarded at a certain time, which would be normal time of kids getting out of class. I'd say, like right around afternoon, and that's kind of the time where we have to cut off for the morning treatments, so that way kind of manage the influx that might come through there.
Yeah, I know at my clinical site, school doesn't get out till 3:30, but we're there at 2:30 just in case, like you said before, if they don't have their 8th hour, they can come in and see us. But treatments are usually done before practice or even during practice, depending on how many people we have to see that day. So just making the athletes aware that they need to come in right after school before practice, and so they're not just being seen during practice and missing out on the practice time.
Yeah. And I've noticed too, I had the opportunity to observe at both of the Ankeny high schools. And at one of the Ankeny high schools, there was a constant flow of kids coming in. And it wasn't like overwhelming. They'd trickle in twos or threes. And this was during practice. So we didn't necessarily get a chance to go out and go to practice and watch practice because we were working on kids in the athletic training room. Whereas the other Ankeny site, there's a mad rush around the final period and before practice that everyone comes in, tries to get their stuff done, and then go to practice. And then we have nobody there during practice, and we're out observing practice. So it kind of just is like Kelsey and Aubrey said before, how you establish and the foundation that you built your athletic training room on, and getting the kids an understanding that what's an appropriate time to use your services and come and see you for things that they may need. So.
Yep.
Kind of going off of that and back to the topic I lost earlier, you would want, with the socialization factor of your athletic training, if you want to have, obviously, it be an inviting place that athletes would feel welcome or feel like they can approach for an issue they might have if their personality isn't the most outgoing. So that way you can be that resource for them, even if you don't have that rapport build. But you also, like I said before, want to have it be an area of business and treatment, not necessarily a gathering area for things outside of what you would be doing for treatment.
Mm-hmm.
So it's kind of like finding a line or just designating that identity for your athletic training room is crucial in the beginning.
I don't know if this has to do, if you guys saw this at all either, but just the maturity of the different athletes from the different levels is kind of a factor as well. So obviously in the high school setting, the kids aren't as mature. So there's a good chance that the conversation and the socialization that they're having in there may not be appropriate or politically correct or can be very offensive towards other people. So I think a very big thing too, if you're in that high school setting, I'm not saying this can't happen in the college setting either, but I feel like it's more likely to happen in the high school setting. To build those policies of what is allowed and what's not allowed and what's appropriate and what's not appropriate, so that there isn't something that would come up and offend someone and then push them away from the athletic training room and not see you and not be able to use your services that you can provide. So I don't know if you guys have seen that at all with your guys'
I completely agree with that. Making sure, like I said, going back to what I was saying, making sure that everyone feels welcomed into the training room and comfortable being there as an athlete, and that this resource is something that they can use without being in a position where they're not comfortable in certain aspects.
Mm-hmm. And then if you do have situations like that, making sure you have a good relationship with the coaches too, so that if you do need to bring it up and they need to handle it, that you have that relationship made, so you don't have to feel awkward by trying to figure out how to handle it yourself.
Yeah, that's a good point. Having other adults on your team to make sure that the appropriate actions are taken. I don't know if you guys, this will probably be the last thing, but what's your guys' cell phone policy within the athletic training room? Because I know at some of my sites, so at Central College, there's absolutely no cell phones allowed. Roosevelt High School, no cell phones allowed. Some other locations are a little bit more lenient on that.
I think at Carlisle, a lot of kids just come in with their backpacks and stuff, so they have them with them. But I think they are aware that they shouldn't be on them or texting when we're trying to evaluate them or trying to figure out what they need.
Or taking pictures on Snapchat, which would be like a HIPAA violation.
That's the main, I think, thing that comes from the no cell phones, is just trying to make sure that everything's HIPAA compliant, so that way there's not any someone snapping a picture and then that being exposed to the wrong people and getting you in trouble for a legal issue.
Yeah.
So, usually setting cell phones, across the board, shutting it down is the easiest way to do that, and again, controlling your athletic training.
Yeah, just having those standards built at the beginning, so they follow them from the beginning, and there's no question on
making sure that you're consistent with your policies, and that some kids can't get away with it and slide by just because they're someone that you work with a lot and that you kind of know them, whereas other kids you may not know as well, you're a little more harsh with them. Just making sure the policy is straight across the board the same for everyone, I think is important as well.
Yeah. Anything else?
That's all for me.
Okay.